Hello there, my name is Olivia Clark and I'm a candidate on the Animal Welfare Science, Ethics and Law Master's degree at the University of Winchester. Welcome to this presentation on free-roaming dogs and welfare-centred population control. We'll start by understanding exactly what free-roaming dogs are, how many there are globally, and what challenges they face. We'll then briefly look at dog overpopulation before examining 3 common approaches to dog population management, before then examining the recommended strategies for welfare-driven population management programs. We'll look at how such strategies can enhance the welfare of free-roaming dogs. Finally, we'll discuss some of the key challenges associated with dog population control and come up with some summary recommendations for welfare-centred dog population management. So to start off, what is the global picture of domestic dogs? The global population of domestic dogs is estimated to be around 700 million. While many of these dogs are pets with a responsible owner, it's estimated that 75% of that 700 million population are free-roaming dogs. Free-roaming dogs are considered as stray dogs, and according to the World Organization for Animal Health, are defined as a dog who roams freely, not under control or restriction, but has an owner or possibly multiple owners, or a dog who roams freely but without an owner. So free-roaming dogs, whether owned or unowned, pose numerous challenges. In communities where dogs roam, conflicts may occur between dogs and humans, including aggression and bites from dogs or abuse from humans. This impacts upon the way dogs are viewed and treated in communities. Dogs may also scavenge amongst waste, with higher densities of dogs in areas where there is easily accessible waste. This increases the risk of disease spreading and inter-dog aggression from competition, and poses issues for local communities regarding how and where they dispose of their waste. Free-roaming dogs also cause significant public health challenges. They account for 99% of cases of rabies transmission worldwide, according to the World Health Organization. They also spread other zoonotic diseases to humans and livestock, particularly parasitic infections such as echinococcus. But in addition to the challenges they pose, free-roaming dogs also face significant challenges related to their own welfare. They face high mortality and disease, such as skin diseases which are left untreated. They may suffer from hunger and malnutrition, or abuse from humans. Inter-dog aggression over territory may result in fights and wounds, and they are far more exposed to potential injuries than confined dogs, particularly from road traffic accidents. They often have high rates of reproduction, and on top of all of this, most are not able to access the veterinary care that they need. Overpopulation of domestic dogs is a significant issue around the world. In the US alone, approximately 390,000 dogs are euthanized in shelters every year, according to the American Society for the Prevention of Cruelty to Animals, due to a lack of homes. In fact, only 23% of owned dogs in the US are obtained through adoption from shelters, while 46% are obtained from breeders and private parties. And there are many contributing factors to this overpopulation, including overbreeding and demand for certain breeds of dogs, resulting in puppy mills, where puppies are intensively produced and results in the commercialization of breeding. But not only that, free-roaming dogs actually contribute considerably to the overpopulation of dogs globally, because their movements are not restricted and their reproduction is not controlled. In fact, in a 6-year period, 1 unsterilised female and 1 unsterilised male dog and their offspring can result in over 67,000 births in a 6-year period, which, in settings where population management strategies are ineffective or lacking, can mean rapid population growth in a very short amount of time, and large amounts of unwanted dogs. As mentioned earlier, these dogs not only cause public health concerns and cause potential conflicts with humans, but they suffer greatly from poor welfare in their day-to-day lives. So, in order to improve the welfare of free-roaming dogs, we need to look at population management strategies, and they need to be employed to reduce the number of unwanted dogs on the street without homes, and to improve the lives of those existing dogs. So that's where dog population management strategies come into play. The World Organization for Animal Health defines dog population management as a program with the aim of reducing a stray dog population to a particular level and or maintaining it at that level and or managing it in order to meet a predetermined objective. Specifically, the primary aims of dog population management in any given setting are to improve the health and well-being of free-roaming dogs, reduce the problems they may cause, and reduce the population size. The International Companion Animal Management Coalition, ICAM, emphasises that dog population management, or DPM, is a permanent commitment, not a one-off project. This means any intervention to control the dog population must be ongoing, sustainable, and meeting the changing needs of the setting where it's implemented, and it does not have an end point. So there are three main methods of dog population management that are most commonly implemented around the world: culling through mass killing programs, reproductive control including catch, neuter and release programs, and rescue and sheltering, where dogs are removed from the street and sheltered. In many settings, multiple methods may be used in conjunction with each other, and there are many additional methods which we will discuss after examining each of these common methods. So we'll start off with culling. Culling typically looks like mass killing campaigns and typically uses methods such as poisoning, electrocution and drowning. But poisoning is the most common approach, with many settings using the poison strychnine. However, culling has been widely condemned as a form of population control due to its ineffectiveness at controlling the population, but mainly because of the immense suffering it causes. However, it's still used in some settings around the world as a quick solution to street dogs, particularly where rabies is endemic, where there might be a lack of expertise in dog population management. So some of the welfare issues associated with culling. Culling is clearly inhumane and causes significant welfare issues, including prolonged pain, suffering and death. And as well as these obvious issues, mass killing of roaming dogs does not actually tackle the source of the population and can actually result in increased movements of dogs, as survivors will move into new empty territories. This can increase inter-dog conflict as new territories become available, and can also increase the likelihood of abuse from humans as new unfamiliar dogs move into communities. Culling dogs through poisoning also puts non-target animals, pets, and even humans, particularly children, at risk, as well as potentially contaminating the environment and water sources. So a second approach is reproductive control. Reproductive control is usually performed through surgical sterilization and catch, neuter and return programs. This prevents unwanted dogs from being born and reduces population growth. Catch, neuter and return programs are typically used for community dogs who may not be confined in one place but have caretakers taking care of them. Reproductive control requires extensive resources, including veterinary professionals, equipment, space, and multi-sectoral coordination, as well as awareness and understanding from community members. Education around this is really important, and myth-busting is also crucial to a successful sterilisation programme to ensure that dog owners and caretakers understand that it will not negatively affect their dog. Some of the welfare issues associated with reproductive control are catching and transportation methods. So while reproductive control is generally considered to be humane, there are some unique welfare issues, particularly because free-roaming dogs may not be familiar with human handling. They may avoid human contact and they may avoid catching. So humane catching and transportation methods must be used to minimise their stress. Further to this, skilled handlers and veterinarians must be used. If surgeries are performed by unqualified or unskilled people, dogs are at risk of complications and even death. Sufficient resources also need to be used to carry out the surgeries in a safe manner. Reproductive control programs are also only really successful if the dogs have a generally good welfare and live in a community which tolerates and cares for them, or they're returned to their owners, who are then educated in responsible dog ownership principles. If there are dogs in poor welfare and in conflict with the human community in which they live, sterilising and returning them is inhumane and prolongs poor welfare and suffering. Lastly, rescue and sheltering. Rescue and sheltering is where dogs are removed from the street and either rehabilitated and rehomed or euthanized. When rehoming, such a tool is only relevant in contexts where there is a culture of rehoming and a demand for rescue dogs, and this is not applicable in all settings, particularly where human-dog relationships are not positive or if there are certain stigmas attached to free-roaming locally bred dogs. Like with the other tools we have discussed, rescue and sheltering is not a fundamental population management tool when used alone, since removing dogs from the street does not actually address the core issue of overpopulation. However, it's generally a popular tool around the world because of the idealised nature of taking dogs from the street and placing them in homes as loved companions. But there are really complex welfare issues associated with rescue and sheltering, starting with the catching and transportation methods, as previously discussed. But once in the shelter, there are numerous stressors that impact upon their welfare. This includes confinement, new sounds and smells, unfamiliar animals, and being handled by people. Many of these are new experiences to dogs who have spent their lives roaming, especially when they're confined and handled, and this may cause significant stress. Dogs may also be bored, frustrated, isolated, socially deprived, and unable to express their normal behaviours when they're confined. Long-term kenneling also poses unique welfare issues. Dogs kennelled for an extended period have been found to be more susceptible to illnesses such as kennel cough and show more stress-related behaviours such as vocalising and having difficulties to relax. If rescued dogs are not able to be rehomed, either because of behavioural or physical issues or because of a lack of homes, long-term kennelling is not a good welfare solution for free-roaming dogs. Rescue and sheltering also requires extensive resources, money and expertise. Training and managing staff may be challenging and financial costs are high. If staff and resources are mismanaged or limited, the shelter will run ineffectively and welfare will be compromised. Dogs rescued from the street with the intention of being rehomed may require extensive rehabilitation and training, and such expertise may not be available in all settings. This may result in dogs being kennelled long-term or behavioural issues compounding stress in the shelter. So the main DPM tools we've discussed mainly focus on treating the symptoms of a roaming dog population. These are the main methods of dog population management around the world, but it is evident that not one method is perfect, nor guarantees improved welfare for free-roaming dogs. As we discussed earlier, dog population management must be permanent, humane and long-term, and prioritise the welfare of the roaming dog population. In light of this, the International Companion Animal Management Coalition have outlined a series of fundamental and context-dependent DPM strategies that prioritise dog welfare and lasting change in their dog population management guidelines. The fundamental strategies include promoting responsible dog ownership through educating dog owners and community members about how to care for their dog, including health, diet and welfare needs. Building provisions for basic primary health care for dogs through accessible veterinary services. Building provisions for accessible reproductive control. And building the capacity of multi-sectoral DPM professionals in any setting where population management will be carried out in order to have a dedicated task force for this. The context-dependent strategies include formal education of children in areas of dog care and needs and how to behave safely around dogs, holding and rehoming facilities, identification and registration of dogs to allow for the tracking and enumeration of the dog population in any given setting, controlling commercial breeding and selling of dogs, and managing access to resources, specifically food sources, to better control the habitats of free-roaming dogs. This includes improved garbage collection and waste management. These fundamental DPM strategies are considered fundamental because they promote lasting change and prioritise welfare. When all four strategies are employed, the health and well-being of existing dogs will improve, as they will be cared for in a more responsible manner and their caretakers will have better and more affordable access to veterinary care and reproductive control. It will also reduce the number of unwanted dogs who ultimately suffer from poor welfare through improving access to reproductive services, and there will be a task force of expert DPM professionals to advocate for humane strategies. So it's evident that there are a variety of welfare considerations to make when managing free-roaming dogs and controlling their population. Ultimately, humane dog population management is complex and multifaceted, and there are several challenges that must be taken into consideration. Firstly, in order for humane strategies to be implemented, local, national and regional authorities need to be supportive and create the necessary legislation and access to resources so an enabling environment for DPM is created. DPM strategies should be led by a multi-sectoral group involving veterinarians, public health specialists, education sectors and the local government. Without support from the many sectors which DPM is involved in, a comprehensive approach cannot be taken. In addition to support and governance, the local context should be taken into consideration. Western notions of what dog population management should look like might not be relevant in all settings, and often these notions dictate conversations around DPM in different contexts and may not take into account culturally specific ways dogs and dog ownership are viewed. Further to this, community members who live alongside free-roaming dogs must be aware of the DPM programme to ensure their understanding, trust and support. Overall, there is limited research on dog population management, and where there is research, it's usually been conducted in urban areas. Implementing an effective humane DPM programme is very much based on the local context and the resources and expertise within that setting. Very often, The lack of resources and expertise is what makes a comprehensive DPM program so difficult to implement in many places, which is why culling is often the fallback to control roaming dog populations, particularly in lower income economies. In order to combat this, collaboration across countries to share expertise and publishing of case studies when DPM has been successful should be a priority, alongside the capacity building of DPM professionals in local settings to create contextually relevant, welfare-centred solutions. So to summarise, dog population management of free-roaming dogs must be welfare-centred. There are various welfare issues free-roaming dogs face, and managing this population by ensuring existing dogs have appropriate care and reproduction is slowed improves welfare. Dog population management must be humane, prioritise and improve welfare, and in order to do this, programming should include reproductive control through sterilisation, access to veterinary services to improve the health and well-being of existing dogs, education on responsible dog ownership to equip dog owners with knowledge and skills to look after their dogs properly, and capacity building for local dog population management stakeholders including veterinary professionals, welfare scientists, public health professionals and local and national government bodies to equip them with the expertise to carry out and maintain effective and humane dog population management programs. While this has been a very brief overview of the complicated nature of DPM and free-roaming dog welfare, I hope you have found this video informative, and do feel free to leave a comment or reach out to me with any questions you have on this issue.